What about campaigns, election, etc.? Because you did the comparison with India, and I remember India had that major blowout of COVID because nagkasabay o nagkasunod. They had a nationwide religious festival. They had the election, the campaign period, and then the elections. And before you know it, there were so many cases and people dying. And kumbaga, yung crematorium nila sa kalsada na ginagawa o sa tabing dagat. What are your concerns about the impact of the elections and the campaign?
Well, may concern yan, Sito. And another example na bibigay ko is South Korea. They recently had their elections. And because of that, yung cases nila ballooned to, I think, 500,000 per day or something, around that level. But it's usually multifactorial yan, Sito. So, ibig sabihin, hindi lang yung factor ng campaign rallies kasi we had sufficient vaccination, okay naman tayo. Kaya lang, pag nagkasabay-sabay na we're still having the rallies, kasi we've been having the campaign sorties for more than 2 months now, wala pa naman tayong nakikitang major surge or a serious increase in cases. Pero pag nagkasabay-sabayan, yung campaign sorties, and then waning immunity, which is happening around this time, kasi 3 to 4 months after January, we're starting to have waning immunity. And then new subvariants that could be entering the country kasi hindi naman strict na yung borders natin. So those three factors could trigger a surge. So without, if we're just looking at maybe 1 or 2 factors na ganun, baka kulang pa sila. Nung February, we had that campaign sorties pero malakas pa yung immunity natin. Wala na pang major new subvariant. Hindi tayo nagkaka-surge. But that could be changing now. So exacto around this election period na, we still have the mass gatherings, we still have, and then yung isa pa yung decreasing compliance with the minimum health standards. So 4 na factors na yun. Those could all be occurring at the same time this election period. And that's a concern. That may be the one that will trigger the surge. Although, like I said, baka hindi naman kasing lala yung surge as January. But we can't say that for sure then at this time, Sita.
South Africa and India, they have modern places and they have areas that are very squalid or impoverished. What makes it a certainty that we're going to have those variants here in the Philippines?
Well, yung Omicron, Sita, hindi naman natin napigilan nakapasok sa Philippines. And this is highly transmissible, itong mga BA4, BA5. So ang dati kasing sinasabi na, baka makapasok yung subvariant na nasa China, which is really a subvariant of BA2. Tayo, nagkaroon na tayo ng BA2. So we have some protection against BA2 already. So kaya hindi tayo ganun ka-concern. But meron pa rin concern dyan. Kumaga, what we're looking at is yung mga breakthrough infections na pwedeng mangyari with these new subvariants. Kasi hindi naman lahat naka-breakthrough. So, kunyari, yung mga ibang subvariants, even the Omicron XE, which is parang binabalita nila, that's a concern. So far, wala pa naman tayong nakita dito sa bansa natin. So, we have similar characteristics. Yung sabi niyo nga, Sita, yung we have a relatively high vaccination coverage, 60% of population. Pero we know na immunity is waning. And yung timetable, usually mga 3 to 4 months after a surge, nagkakaroon ulit ng panibagong increase in cases because of the waning immunity nga. Kaya usually mga waves natin, they're about 3 to 4 months apart. Nakita namin yung pattern na yun. And ganun din sa South Africa, it's about 3 to 4 months since their previous surge ng Omicron. And now, tumataas ulit yung cases. But to be fair, we don't think this is going to be as bad as ng January, Sita. We don't see 60,000 cases per day. Kasi January, we had up to 40,000 cases per day. So siguro, this one will be much lower based on our preliminary analysis. And karamihan, mild lang naman siguro because most people have been vaccinated. And that's the advantage of having the vaccines. Mostly, it will be mild. Pero syempre, may mga tatamaan pa rin na severe kung lalo na kung hindi pa vaccinated.